Hi, I'm Dr. Rudy Cashman. Welcome to our show, and thanks for watching our other shows. Frankly, I'm about wellness, and I always discuss a little bit sort of the wheel towards wellness. I have about 8 things on it, and number one on this wellness wheel, you can get a copy of it by cashmanhealth.com, and there's phone numbers in there. And number one is participate in your health care. And that's number one. Number two is nutrition. Number three, exercise. We can go around the wheel. But you must develop some understanding. Depression worries me quite a bit. If you read the paper the other day, you could see that the government physician is recommending that all women who are pregnant or postpartum, post-pregnancy, that they would be screened for depression. I mean, we've known for years that it's not uncommon, maybe up to 30% of women they describe as blueness, not major depressions. They feel blue for a while. They're not interested in anything. They're crying a lot. They feel hopeless. But when does it go into major depression? That can be missed. So they recommend all women would be screened for depression. They can take some tests that are already designed, questions that they ask, a questionnaire they could fill out while they're sitting in the waiting room, for example. In numerous books, I have a lot of books here with me, I'll give the names of them, and we'll discuss some of the questions, because where I read 10 to 30%, I tend not to believe 30, but it's seen so many times in literature, a significant number of women commit suicide because of these depressions. They feel that down. I have a close relative who had a baby recently, and she cries all night, and her dad is taking care of the baby at this time. So it's a common thing that can enter into our lives. I personally think, from what I know of mind-body illnesses, what I know about them, I'm going to discuss those next with you a little bit, that I think all women, almost like a blood sugar, while they're waiting to see a physician, should maybe take a depression test. Yeah, just like I recommend people get a gluten test at any age, at least once in their lifetime. I think for women, because they have more responsibilities, their hormones change every month. We have 50 hormones in our body. Can you imagine having to feel good when you get 50 hormones going, and a number of them rage about every 2 weeks, and how that can affect your thought process? That I think depression screening in women, in all women, I begin to think maybe all women need to be screened for that, especially if there's some difficulty like alcohol or drugs or abuse. I think that screening needs to be increased. So I agree with the screening, especially during pregnancy, after pregnancy, that this would be automatic, in essence, be mandatory, because it is that common. On the average, women, there's a higher incidence, maybe 2 to 1 over men, in depression. And what do we mean by depression? Years ago, 1,000 years ago, they called it melancholy. Okay, Hippocrates renamed it, and then we have now. It's when people are despondent, hopeless, can't sleep. Sometimes they'll go into mania, where they have their weeks or months feel down all the time. Nothing looks good, hopeless. Nature doesn't relax them. Music doesn't do any good. Nothing to live for. I don't want to go to work. I have no ambition. I don't care. These can be symptoms of despair, of depression. It can have a cause. It can be family problems, but many times it doesn't have a cause. Sometimes, like I said, just a baby, and because of hormonal changes largely, it can be the increased responsibility. Some can imagine a woman managing 6 kids every day. You know, I was visiting one of my kids and his 3 grandchildren, and all well-behaved children, but just the complexity of the mother dealing with them every day, geez, I mean, I'm not sure I could take it. So that's increased responsibility, hormonal ranges, all can be signs of depression. And what's interesting is I spoke to Paul Wilson, a big-time psychiatrist on State Street. I saw him at a talk recently where I gave a talk too. He said 50% of the people who go see their family doctor have mild, medium, or severe depression, and they're misdiagnosed 90% of the time. Why is that? Because it can be difficult to pick it up. They're not given tests for that, rather, say in the waiting room, or people ask the right question. But they come in, and part of the confusion is they come in decorated as other symptoms: headaches, low back pain, skin rashes, bowel symptoms, headaches, migraines, heart palpitations, all sorts of symptoms, and that it really exemplifies them. And the reason is the mind-body connection, which hardly anybody knows anything about. I like to just bring it up a minute here. Candace Pert wrote a book in 1972 called Molecules of Emotion. Then I wrote a book called Welcome to Your Mind-Body, how the mind affects the body, maybe 10 years later. And I discovered in my 45 years of being a neurosurgeon that a lot of the people I was looking at had a presentation of a mind-body illness, but had been misdiagnosed, partly because of technology. You know, years ago we called it hysteria. That was at Freud's time. Then we called it myasthenia, 1850, 1920. They used to lock women up in hospitals for a year at a time in Michigan. Yeah, in Michigan. And one of the Kellogg brothers, remember, the cereal Kellogg's, became a doctor, almost a doctor, and he owned one of those institutions. They didn't know better, and those were people who had mind-body illnesses. No one knew what they were, and people would be locked up, especially women, because women are 10 times more stressful than men. I wrote a book, Welcome to Your Mind-Body, and I have it in there. And increased responsibility. They get all the kids, men and women get a job, they don't control the budget, and they get these hormonal rages. And then the big guy comes home, he wants dinner ready, and women will go see their doctor a lot of time with a physical presentation of stress. When they call it mind-body illnesses, Candace Pert called it molecules of emotion. She discovered the opioid receptor site, where every cell in your body has the receptors, and where morphine worked by hitting one of these receptors. She's the one who discovered that. First time we knew how drugs work, and then she said, our brain makes neurotransmitters, hormones, neuropeptides that are secreted by our thought process that enter the bloodstream, and also do it hormonally also, and through neurotransmitters, which are the connectors between axons and the dendrites, and they affect those 70 trillion cells, especially the bowel. The bowel is full of these receptors. The heart is full of these receptors. So how we think affects us. That's the mind-body connection. Remember Dr. Wilson saying he had not read Candace Pert's book, or my book, Welcome to Your Mind-Body, but the next day after I heard his lecture, I brought them both to his office, because he, from his own experience, developed that, improved what I've been talking about. Very interesting. So, and depression is due to lack of serotonin, dopamine. So people don't feel good. They're traveling down here. They're traveling to a very dangerous situation. A significant number eventually commit suicide. It's even seen in children. You don't see a lot of it before age 12 or 13, but teenagers it picks up. And significant among teenagers, the second most common cause of death in teenagers is suicide over depression. And you know what they use the majority of the time? A gun. And a gun, if a man uses it, usually is 90% successful. So of the gun deaths you hear about in the nation, you know, about 40,000 people died from guns last year. 60–70% of those were suicides. And the men do it, they're 90% successful. The women do it, a lot of them are not successful and end up with injuries from guns, and this is how they lead their life. And they're still depressed. So if you have a depressed person in the house, get the guns out of there. Matter of fact, the most common person to die from a gun in the house is not some robber. It's a family member. It's been proven. I can show you the stats because I'm going to write a book about the injuries. Okay, I'm not against having a gun. It's about the injuries, proper use, proper locking them up. That's what I'm speaking about. So the mania, there are definitions of depression. We have major depression, where people feel very down. And then they have a bipolar, where you feel down, and other times you're hyperactive, you're invincible, you're God, you can fix anything. That can go on for a week, can go on for months, sometimes it goes on for years. Many times it's undiagnosed for years. Depression runs in families. So there are a lot of family members have depression. Watch out for the kids or other family members developing. Look for the signs and symptoms so it can be helped. Incidentally, the first line of defense is a diagnosis and medication. Had to be provided by a physician. Don't necessarily have to be a psychiatrist, although psychiatric help certainly helps. But there's so many people that are depressed, so many are misdiagnosed. That's the reason I say this questionnaire needs to be given to a lot of people, especially women, but men too. Fill out that questionnaire. It's missed too much. I think it's like gluten testing. We do 5% maybe depression. We're missing most of them. He's listening to Dr. Wilson. When 50% of the people go to a doctor get some form of depression, I think we should be giving depression tests, frankly, maybe to everybody, unless it's, you fell down, you broke a leg, well, you know what you got. And so we have major depression, okay? Then there's something called dysthymia, which is a milder form, of feel down for a few days, then you feel good. Okay, so not everyone who feels down has a major depression. And if you're bipolar, you can be up for a period of time and then you're down for every time. This mania can get out of hand. They'll talk so fast you can't hear them because they're talking so fast and they're much exaggerating their present situation. That's a mania. Okay, there can be mild forms of that, but some can be very serious. They have given lithium for that, very effective. So drugs have a definite place in this, but it needs to be given, frankly, by an expert. And major depression is that 2 to 3 times more common in women than men, and it affects their mood, their cognitive ability, their sexuality, their work, and it's more common during the cycling of the hormones. Teenagers, remember I said, get it, but girls, teenage girls get it much more than teenage boys, which is kind of interesting. If they're to the point where they have delusions and hallucinations, where they're, seeing things and are deluded as to what the situation is, that's really advanced situations, but it does occur. So you have to watch for that. So, so how do you know you're depressed? It can be difficult to diagnose, even in family members. So I think to take some of these verbal tests to kind of see, to put you on a scale, for example, they're available in these books. Your doctor should have them readily available. And if you put on Google depression test, bang, it'll show up right there from the CDC. And the appetite in people go down. Some overeat, some undereat. Some sleep through, don't wake up. Others can't sleep at all. So it's very variable. Sex drives can go down. If you're hyper, it can even go up to the point of being pathological. People are more anxious. Some panic. 70% or so, they're thinking undiagnosed. Yeah, that's big. That's like gluten, where about 90% are undiagnosed. And the reason that's important to know, because suicide rates, 15 years of age to 24, a reasonable number of suicides because of depression. So stress can cause it, a sudden event, a death. You can take a stress test. If you read my book, Welcome to Your Mind Body, I have a stress test in there. And the most common causes of stress are death in a family, okay, or a spouse, divorce. They'll rank the stresses right down to loss of job. You know, these are all on the path. And if you add all that up about a certain level, then we know you're much more stressed than others. So in my book, Welcome to Your Mind Body, is actually, you can take a stress test and it puts you on the scale as to how severe it is. And some people need medication, but there are many ways to reduce stress. But severe depression, you need medicine. You need medicine, maybe moderate depression. And it's tough to tell which there is, really. They have used in the past a lot of medications from SSRI inhibitors, where they don't allow the serotonin to be destroyed. Serotonin makes you feel good. Dopamine makes you feel good. They're the feel-good hormones. Okay? Many drugs can be effective, but if you give them to an animal, they work in a day, but on a human, it can take weeks or months. So you don't want to rotate pills every 2 weeks. Give them a chance to work, but an experienced physician or psychiatrist should be one prescribing, because it takes a lot of experience. With these medications. When should it be switched? That is something they need to do. I'm not saying a thing about medication, when or when not to take it. But certainly, if you just, I have Rudy's 20 prescriptions for stress reduction available on my website, cashmanhealth.com. That things to reduce stress in your life. They're not for major depression. Okay, we all get stressed. Who doesn't get stressed? If I didn't get stressed, I wouldn't get out of bed. Okay, and you know, some of us, for example, I did neurosurgery 45 years, and after a stressful day, you get in the car, I turn on the music, bang, and I'm conducting the orchestra, relaxing very quickly. I play sports a lot, play more now because I get more time. That's relaxing. It secretes endorphins, our own feel-good hormones, for example. But try not to use narcotics to reduce stress, for example, because they're addictive. You become addicted to them. Use the regular, approved relaxers for stress, for depression. And they can be very effective, but they are not without side effects. And remember, suicide. Sometimes somebody would commit suicide, and it's totally unexpected. I know somebody that walked out of the back door of the house, and there's hanging a 16-year-old boy. There was, as far as I know, she couldn't come up with a clue why this happened. So in teenagers, you can look for things like doesn't play sports anymore, sudden weight gain, sudden change in the way they sleep, a change of behavior, family conflict, divorce going on. Watch the teenagers. And because, I mean, can you imagine a suicide in the family? This mother, in this case, I think is still having horrible problems. And fully understandable. Who knows how we will react, how we would react. So, like I said, 70% are not diagnosed properly. The American Psychiatric Association has a list of questions that you can ask, you know, along the path. Let's go through some of these. They'll speak about a major depressive episode in your life. You know, maybe a divorce, whatever. Depressed mood, diminished interest or pleasure in activities, significant appetite, weight loss, weight gain, insomnia, can't sleep, feeling of worthlessness, excessive guilt, diminished ability to think or concentrate, recurrent thoughts of death or suicide. They call it a major depressive episode. The question is, will it continue? Certainly, if it continues, a medication and consultation are important, but we don't know what stage would a suicide be considered. You know what I mean? Death of a spouse, for example, or impending divorce, for example. I mean, it could be quick. And then for dysthymia, which is the milder form, sort of the same things really. loss of energy, low self-esteem, poor concentration, feelings of hopelessness, never manic or clearly hypomanic, where you just sleep forever or you're so active. That's bigger stuff. That's not minor dysthymic things. And so significant symptoms cause significant distress or impairment in important areas of functioning. No longer going to work, for example, would be a hint that this is maybe a mild form of depression, but maybe it get worse. And let me give you the symptoms of a major manic episode where you're hyperactive. Inflated self-esteem or grandiosity, decreased need for sleep, maybe not sleep at all, and more talkative than usual. Flight of ideas or subjective experience that thoughts are racing. And I wonder sometimes my thoughts are racing, but I sure don't lack self-esteem, so I don't know. You got to have multiple things, not just one, okay? And excessive involvement in pleasurable activities which have high potential for painful consequences. Could be alcohol, could be drugs, for example. Distractibility would be towards a mania part, okay? And some people have a mixture of these symptoms. These tests are all listed in some of these major books, and you read through them, but your doctor's office should have a screening test available to pick up depression for you, printed out by the government, the CDC, for NIH, for example. They have these tests available. You can print them off yourself. And they have a self-rating scale, so they have numbers attached to them, okay? So especially if you see a family member out of a tuned environment, they're not acting right, you're on vacation and they're just laying in bed. I had that happen to a family member, laid in bed the whole time. In retrospect, when I think about it, I think the person was addicted to drugs. Yeah, was a teenager. At a major hotel in a big vacation spot, and then in a hotel all day watching television. There's a clue for you. There's a clue for you. Not enjoying the day. I mean, that's sort of interesting. So the biggest thing, though, how commonly, that is missed today, which is of a great concern. Now, here's some books I'd like you to be familiar with. Here's Understanding Depression by Ainsworth. Patricia Ainsworth is a book that I encourage you to read. Understanding Depression by Raymond DiPaolo. Raymond DiPaolo is very good, describing the medications and that are good, so you know that you have some idea of the side effects, and good chapters on what to do about suicide threats. That's complex. We could talk about that for an hour, but I recommend take it seriously. Just take it seriously. Sometimes they do it for attention or one thing or another, but you don't know. If the next thing you find somebody hanging in the attic, you say, geez, I wish I'd have done this. So any suicide threat, take it seriously. Take the teenager, husband or wife or whatever, to a counselor for them to study this in more detail. And I personally, not everybody may recommend that, I personally get the guns out of the house because that's used. When we're talking about, 20,000 or more deaths by guns, suicide, 90% successful, much more successful with men than women. Women end up a lot of times surviving it, and then they're disabled. Two, now they have an additional problem, and I saw it as a neurosurgeon. I'd see people commit suicide and lost their speech, paralyzed, and can't do enough, and this is the way they live, probably in a nursing home the rest of their life, or depressed to begin with. So it really is something you need to take seriously. Especially if there's abuse in the family. For example, you need to have the people evaluated for depression. I think this is very important. There are certain illnesses that'll trigger depression. For example, like heart attacks are associated heavily with depression. About 6 weeks, can be sooner. They leave the intensive care, can be sooner, can be 2 weeks. Start looking for signs of depression. And it's partly hormonally, neurotransmitter based. No one knows for sure. But act on it quickly, because you could end up with a loved one that had a heart attack, survived it, could probably live, for decades if they eat the right food, exercise, for example, which they may not have done beforehand. At this point, they need to be taught wellness, but psychological wellness too. Many end up severely depressed. It's missed, and they commit suicide or lay in bed more. The muscles atrophy because I don't feel like working out. I don't have the energy. You say, oh, the lack of energy is due to heart disease. The lack of energy could be due to neurotransmitters. The lack of energy could be lack of neurotransmitters. So you need to bring music into the life. I brought music into the life of a lot of my patients, because it very quickly causes increased secretion of neurotransmitters, and people feel better very quickly. Exercise is very helpful. Is very helpful. It increases endorphins, your feel-good hormones. So let's summarize this a little bit at this point, and get some of these books. I had one other one I'd like to recommend to you, by Mark Williams and John Teasdale, The Mindful Way Through Depression. So you need to participate in healthcare, do some reading, because this is common. Remember I said half the people go see the health care provider have mild, medium, or severe depression, but the symptoms are decorated as something else. They don't walk and say, I'm depressed. They come and say, I got a headache, I get neck pain. And 90% of the time it's missed. So a family member must keep this in mind and tell the doctor, I want that depression test to see if that's it. Especially if they have a chronic complaining illness and no one ever finds out the reason, consider depression as being the problem. So I want you to learn about the mind-body connection, Kenneth Pert's book, Molecules of Motion, my book, Welcome to Your Mind-Body, so you understand that the mind affects the body. And I'd like to get regular testing done. The depression test, consider the depression, that's half the symptoms. Learn the mind-body connection, that's probably another 30% of the symptoms. And then I'd like to get some screening for pre-diabetes or diabetes if your weight's off at all. But there's some skinny fat people, and they have actually diabetes, don't know it, and they're even thin. Proper testing for pre-diabetes is to run a 2-hour glucose tolerance test to get a fasting blood sugar and a serum insulin. Follow work, go to my lectures, you'll find about that. 1 out of 2 people are pre-diabetic. So I mentioned all these screening tests from gluten to glucose tolerance test to depression screening, because they're the cause of a lot of our illnesses, which are all, Rudy's good news is, preventable, stoppable, reversible. But we must participate in our health care. Thanks for listening. This will be shown on Monday. I think at 7, then Wednesday I have another show showing, it's at 6, that one's on gluten. Look at cashonhealth.com. I've on there 150 YouTube shows about every health subject you can dream up. We love you, and I hope you participate in our stuff. We give 2 free lectures at Lutherans a month. You can look at 150 to 200 YouTube things and if you see me, give me a hug and ask me a question. We love you very much. Thank you.